My name is Adam Mullis, and we're going to talk today about the health issues that are going on with students. I did want to take a moment to talk a little bit about myself, just where I'm coming from and my expertise. So it's my 7th year working at a middle school setting, teaching health and physical education. You can see some of my qualifications, and I'm currently working on my PhD, and it is in health education and promotion. I've also been lucky enough to attend and present at a few statewide conferences along with national conferences, and I'm really excited to talk to you today. Some assumptions. It's really important that um, it is said that I am not a parent. I could not imagine how difficult with recent current events and technology it would be to be a parent at this particular point. But we will talk about what data says and what data is. But the bottom line is you know your student best, and just because it's statistically an issue does not necessarily mean it's an issue with your student. And I will not tell you my opinion, but what best practice says and what experts are saying who are qualified to say so. So I want you to take a moment and think, not necessarily with your student, but as middle schoolers as a whole, what are some issues facing them at this point? And then maybe you want to write that down, and then I will tell you what students and teachers and data is saying. So go ahead. You can pause the video if you like. What teachers said. So I surveyed about 10 teachers about what they thought the biggest health issues that students are facing, and they said screen time, so the amount of time on cell phones and or computers, TVs. Mental health issues are access to professionals or lack thereof. Physical activity time, with not being able to get outside or not wanting to due to technology, and not having access to quality food. I ask students this a lot in health class about what they think the biggest health issue is for their age group. They say vaping, which statistically they do have a point. Healthy eating, cyberbullying, and obesity is what they mentioned. So we're going to look at the leading health indicators for 2020. And three of the major indicators for health and wellness were mental health, nutrition, physical activity, and obesity, and then oral health. Some of these topics we will cover today. So what we're looking at now is the actual data from what the students said. So this particular survey was given to all Griffin students, or at least most, and they can take it anonymously. There is no evidence of who took what. We can only say what grade level and what students or what grade level took the survey. There is no, I can't tell that, little Bobby took this survey or not. And over the years, most of the activity is relatively the same, which is pretty crazy because you think, oh, middle schoolers would lie, but not necessarily, especially when it's anonymous. So looking at the data at Griffin Middle School, and by the way, this was last year, and that's the most current survey data we have at the moment. So it looks at days that they were physically active, and that got cut off there, but that's obviously more than 4 to 5 days was about 290. 4 to 5 days a week was 348. Not at all was about 235, and then 1 day per week was around 130. So interesting data there. The next one is vaping and marijuana. These two particular drugs were the most common, although statistically not very likely to happen at Griffin Middle School, according to the student survey, but they were the most popular out of the drug choices that were given. It's important to have conversations about health risk with your student and help them understand as we try to reinforce those messages at school. So next, we have mental health issues, which was statistically another thing that was relevant. So this question asks, how many times are you having some sort of mental health issue with involving peers or family issues? And you can see the data there goes from 1 or 2 days to all 30 days. And most students described within something within those time periods. Social media. This was a bit of a surprise for me, statistically, to be honest. You can see that, only a few times to a fewer times, and it's talking about how much they use social media or have issues on social media. And many students said never, which was very interesting to me. So what can we do? We talked about some of the negative health behaviors that we're doing and that we've seen. And one of the big things that research suggests is simply monitoring students, asking questions like, where will you be? Who will you be with, and when will you be home? Checking students' phones and technology can be a good way to hold them accountable. And getting to know students' parents, or if you decide that it's appropriate for your child to be in a relationship, that you get to know their parents as well. In my experience, that students, of course, don't always love to be monitored. However, with their adolescent brains, it's very important that they have guidance from someone who has a fully developed brain, so they can make the best choices that is possible. And here's some more tips, talking about your teen, about rule and expectations and morals and values that you find important. And we talked a little bit about those as well. So with screen time, the CDC says that 7.5 hours is the average for entertainment, and 4.5 are spent watching TV. Of course, that could be on a computer as well. And the CDC recommends that students get at least 60 minutes of physical activity per day, which can be anything from going on a walk with a parent, walking their dog, doing some type of yard work, playing a game. Great ways for students to get physical activity. The food recommendations, it's changed from the food pyramid, and the food pyramid got turned on its side, and now it's My Plate. This is based off like a 135-page document. In short, trying to get students to eat more fruits and vegetables than grains and protein, and then of course dairy as well. And nutrition can be complicated if you look at how many ounces of this and how many calories, but in short, really trying to encourage students to eat fruits and vegetables, and making vegetables and fruits appetizing to them, which maybe even a smoothie or some way, and helping understand the importance of having fruits and vegetables in their diet is critical to set them up for lifetime health and wellness. For more resources, kidshealth.org is an excellent resource, and I will note that kidshealth.org has anything you could possibly imagine related to health and wellness, and it is approved by doctors but written for students. So I highly recommend that resource with your guidance, of course. And you can see some other resources there about raising healthy teens from the CDC, and a Scholastic article as well with phone safety, which is huge at this point of time. There's also, with mental health issues, understanding the signs of mental health issues. Suicide Prevention Lifeline.org has some great resources. Definitely understand this can be a very serious topic and maybe uncomfortable to talk about, but it's very important that we understand that mental health issues can impact anyone. And if we are educated and understand that with professional help, students can definitely be successful if they're having mental health issues. Very important to know the signs so we can get students help if and when they would need it. Physical activity, there is a youth center in Smyrna. And please, the Silver Comet Trails are also great ways to get physical activity and get students away from technology. And of course, if you need any more resources and you are looking for a specific sport that you wanted to get your student in or something like that, feel free to contact us. But there are some resources there. Griffin has some great resources as well. Our guidance counselors, our school counselors are terrific, and they're right there. And of course, they're at copk12.org. They have some terrific resources. If you are interested in anything related to mental health, or maybe something they need to talk about with that, they could either help with that particular situation or point us in the right direction. and they are fantastic with that. So I do want to mention that as well. So once again, this presentation was just trying to emphasize the importance that middle schoolers, even at a young age, do have some health concerns due to whatever is popular in our culture or what they see necessarily on television, and they need your help as the adult in their life to make the best decisions. So monitoring, talking to your student, and understanding and knowledge of health concerns is critical. So I wanted to provide a really short video and along with some resources that you could use. Being a parent is no doubt the most difficult job I could ever imagine. So thank you so much for tuning in. And if you have any questions or comments, feel free to email me. I'm also on Twitter as well. So thank you so much, and I hope that you have a great day.